I'm wondering that intersection, the healthy sexuality, the non-pathological side versus addictive, because we get critique as CSATs from, let's say, from sex therapists who might say, oh, we're just pathologizing behaviors that
Right.
are not problematic, and we're bringing shame where it shouldn't be there, or those kinds of things. So I guess, and you mentioned it before, but how do we differentiate, what's addictive, potentially problematic versus
Yeah.
what's a healthy sexual expression for somebody? Because that's such a loaded topic.
Absolutely. And one thing to understand about that is your typical therapist in the general population and many of your sex therapists are not working with sex addicts that have really gotten out of control with their behavior. And they have to, like for me in the inpatient world where I work with people that are in residential treatment, the people that I work with typically have destroyed their lives with their behavior, right? And so, oftentimes CSATs see people that where their behavior is very unmanageable. But in the general population, many therapists uh, generally might be seeing some people that are doing some erotic role playing or having fun with this, right? And they're not struggling with it. And so we don't necessarily, as therapists, we have to be careful about when people come to us, making them feel judged or stigmatized, right? Because nobody wants to feel that way. And we have to be, and when giving them guidance, we have to be careful about interjecting our own biases in around some of these things. Um, and at the same time, there are times that you can get very out of control, and some of these behaviors can be dangerous and destructive, right? And so there's a balance there that a therapist has to understand, and they have to really understand some of the nuances of these behaviors and when to guide different clients in different directions, if that makes sense.
I'm thinking of the question that did make sense. Let me tell you, it did make sense to me.
Thank you, Jeannie.
I'm thinking of folks who may be listening, and a question I get often here, which is if we know that someone is struggling with sex addiction and some of their behavior involves one of these categories, a fetish, BDSM, whatever's, how can you tell the difference, or what would you look for as one could be an escalation of the addiction or
Absolutely.
part of one's sexual arousal template?
Right. Absolutely.
Like, how
Or
do you,
both.
or both, or both.
Yeah,
And
right, right.
so how does a person, whether client or provider, discern the difference? Because folks are out there trying to learn,
Absolutely.
trying to understand, and they're like, which camp am I in, or do I have things in both buckets?
Right. It's such a great question, Jenny, because a lot of times when people uh, in sex addiction, people's behavior starts to escalate and they start getting into things that they never thought that they would ever engage in. And they're just going for the more next and more intense thing, the more novel thing. And this is especially true in porn addiction because with porn addiction, it's just a lot of it is about novelty and getting the next dopamine hit and just going for the next thing. And it's escalating. And a lot of porn addicts, particular, can escalate into genres that are way outside of their arousal templates. And it's just part of part of being in that preoccupied, ritualized state, addictive state that escalation is occurring in. So a part of the when it's a part of the arousal template, it's a core feature of something that they are aroused by or attracted to, something that is really a core element. And a lot of times it will be something that continues to be revisited. It tends to be a central focus. And so it's not typically something that they're just, perusing, right? It's something that they're continuing to come back to, right?
Mm-hmm. Okay.
And with fetishes, typically it's a particular, we're talking about a specific interest or erotic interest that has gotten pretty focused.